And now for some medical insight from Hartford HealthCare. We are joined live by Dr. William Horgan. He is the Medical Director of Quality and Safety for Backus and Windham Hospitals. Dr. Horgan, we saw that testing rolled out on Monday. How widespread is it now with your health system?
So right now we have multiple sites that are open. We have the one at Hartford Hospital that is open, and then there are plans to open a total of 5 throughout the state. So those plans continue to evolve as we open them, and we will be able to get that information out to everybody. If they are, can call the Hartford Hospital or Hartford HealthCare Clinical Command Center at 860-972-8100. They will be told which centers are currently open, but the plans are for a total of 5.
Okay. So, doctor, who should be calling there? Who should be going for these tests?
So the people that we really want using these drive-through centers are the patients that are potentially infected. And the reason that we have these drive-through sites is to decrease the amount of exposure of those that are at the primary care office or in the emergency department or in the urgent care center, the patients that are waiting to be treated. We want to keep those that are potentially infected away from those sites. So by doing the drive-through testing, we're able to keep them isolated within their car. We perform the testing and then send them right back home with some instructions.
And doctor, tell us, are people following the rules so far with the guidance? Are they showing up with the doctor's order or going through the process properly?
Yeah, for the most part right now, there's still some confusion right now amongst the community. And so that's why we're trying to guide people to go through the Hartford HealthCare Clinical Command Center for specific guidance to make sure that they're following what they're supposed to be doing and going through the testing process appropriately.
Okay, so your expertise is in quality and safety, which is, of course, so important to a medical facility. Tell us what precautions you're taking with all of this testing for everybody.
So this is kind of unprecedented, really. And so the way we're responding in Hartford HealthCare has been tremendous to ensure that we provide testing for those in our community that need it, but also ensuring that we are keeping those patients in our hospitals and those colleagues of mine in those hospitals caring for our members of the community safe from potential exposure to this virus. The restrictions in regards to the visitors as well also help to ensure that those visitors don't get exposed.
And doctor, tell us overall how we're doing. We've been kind of checking in day to day to see how the hospital's doing with capacity, with supplies like masks. Can you give us an update today?
This is something that changes hour by hour. You know, it's very dynamic. What I can say is I'm very proud of Hartford HealthCare and the way they've responded, the way our staff have responded in regards to utilizing the appropriate protective material and ensuring that when we need it, we have those supplies to care for those in our community that are potentially infected with COVID-19.
And when you're back to the testing, when you're doing the testing, how long does it take for someone to get their results?
So in general, we're looking anywhere from 2 to 4 days, depending on the volume and the numbers that are, the number of tests that they're performing. But as the process ramps up, we'll be able to have, we should be seeing a shorter turnaround time.
All right, and tell us more about the visitor restrictions. You just enacted that. So are patients allowed to have any visitors at all, or is it no visitors whatsoever?
So the majority is we're trying to restrict visitors to no visitors for our patients, but there are special circumstances. And the patients and their family members can call the Hartford HealthCare Clinical Command Center to get that specific information. Again, it's changing so rapidly, but right now we're really having a dramatic restriction in visitors within our hospitals.
All right, Dr. William Horgan, we thank you very much for joining us. We know these are busy times, and we appreciate your time, and we will check in with another doctor live shortly.